Blood transfusion therapy is life-saving for patients with severe anemia and acute hemorrhage, but blood supply remains oblique due to the principles governing its collection. Ministry of Health and partners organized the 11th Africa Society for Blood Transfusion International Congress to deliberate on the role played by blood transfusion services in Uganda's healthcare system. To achieve adequate and safety of blood transfusion requires capital and infrastructure investment, funding, a regulatory and policy framework.
Blood is a delicate issue. It requires a lot of attention. Personally, I would also like more information on how blood is handled legally in other countries. We don't have any law that governs blood collection and distribution, except under the National Drug Authority. In Africa, many times we assume that blood is free. So when you get a unit of blood, somebody has paid for it. And in our case, government has been paying for every unit of blood that is given to patients. The director always says she needs $81 for every unit of blood that is prepared.
Minister for Health, Ruth Aceng, told the meeting that the regional blood banks have grown from 1 to now 8, and out of the 18 regions, 10 are still lacking.
There is a lot of blood collection. I think we are able to make about 320,000 units annually, just short of the 1% where we should be making about 450,000 units of blood collected annually. That means we are not yet there, but we shall get there eventually. A lot of blood is used in this country, but also a lot of blood is wasted in various ways. We have situations that demand lots of blood. I think for the last 3 years, we have had a lot of strain on the blood transfusion services because of the malaria epidemic, especially in eastern Uganda.
In this country, our most active blood donors are students in schools. And therefore, the shortages during the long holidays are as predictable as the rains of October. In this country, October you are sure it will rain. In the same way, during the long holidays, we are sure we are going to have crises regarding blood donations.
Health experts say blood safety is a global priority, and in 2017, blood and blood products were included in the 20th World Health Organization model list for essential medicines.
Nucleic acid testing, and I think we are the only country, second maybe to South Africa and Namibia, that are doing that testing to make sure that blood is as safe as possible to be given to a patient. So our blood is really safe. The window period is always narrowed down, and so we can assure you that blood safety is well achieved in UPTS.
Also now I see something good that Uganda is trying to make the best use of the plasma that's collected. How to make benefit of this plasma and not just to waste it without being used for fractionation and providing plasma products for patients.
The Africa Society for Blood Transfusion Congress is on the theme adopting global innovations and technological advancements in blood transfusions. Zahara Abigaba, UBC News.